thanks, look, and thanks and good morning to all our witnesses. Sorry, I'm competing against this bell, so nothing really I can do about it. I was just thinking, like 2 years ago, we were in the throes of a general election, and none of us, the vast majority of people in the state, have probably never heard of COVID. And obviously, we got to know COVID very, very well over the last 2 years. And, you know, it's left a huge mark on this country. You know, issues like, you know, that will probably take a long time to heal. It's been a very traumatic 2 years for a lot of people. And hopefully, I think things are looking brighter than they ever were in the last 2 years. And just kind of looking at the figures of the people that died of COVID, it's literally staggering. 10,000 people on the island of Ireland. Nearly 1 million people in the United States alone have died of COVID. That's 6 million people in the world and counting. It's literally incredible the amount of people that this pretty awful disease has killed. And, you know, it's not over by any means, but certainly I think in the last couple of weeks, I think there's been a sea change in relation to, you know, people thinking, you know, there's a sense that we're over the worst for now. But, you know, we need to be cautious and go with the guidelines and so forth. Just in relation to, I know David Cullinan kind of touched on it, and, you know, the first thing I thought about in relation to Dr. Hoolan's statement was, and I know you probably can't comment on this, but I'd like you to kind of take your doctor hat off and kind of retrospectively, in the last 2 years, what would you, as an organisation, have done differently in relation to the pandemic? Over the last 2 years.
As I said, we have some systems in place that are about trying to improve, because we're still in the middle of something where we're not predicting that we're going to see some of the kinds of impacts that we've seen previously. We still have to be prepared for something to happen, and to happen quite quickly. As you know, the first reports of Omicron began to emerge in the last days of the month of November. And by Christmas, we were in a very, very different situation as a country. That's how quickly things can happen. And we have to be ready to ensure that things can happen and respond as quickly as that. I think that one of the things that has worked well in this country in comparison to other countries is that, you know, if you like, a trusted public health advice, and I'm not just talking about myself, I'm talking right across the board, and including colleagues in the HSE, has been to the fore in terms of the response. And ensuring that the public health voice, particularly in the health service, and the leadership of the health service and how it articulates, that is a key measure that I think we have maybe some further progress to make on, and there are plans in relation to strengthening as much as we can. Every public health system in the Western world has been challenged by the scale of this thing, and as you rightly say, its impact in terms of mortality, like something we haven't seen certainly for many decades, and have to go through a process of now trying to figure out how we can do better to anticipate, to prevent, to respond, and we'll be doing that work, and we'll be doing that work very assiduously over the course of the coming weeks. And we can't wait until this is over, as it were, until we get to some point when, if you like, the concerns about the potential emergence of new variants has abated. We have to try to apply these kinds of measures and try to continually improve our response. We have seen a very large-scale operational response within the HSE to do some very impressive things, as we all know, standing up the vaccination programme and booster programme, standing up the testing and tracing capacity and all of that. We need to now make sure, as we move forward, that we build all of that into a regionalised public health response capacity, which is intelligence-led, where we have good quality public health data available to public health teams on the ground to enable them to respond as quickly as they possibly can. It's, in general terms, a correct principle, if you like, to say that the earlier you can intervene on the emergence of a new outbreak, you spot something unusual happening at a local level and put in place measures to try to mitigate that and prevent that from becoming established as wider spread infection, the better the chance that you have of mitigating the impact of that. And then in particular, given what we now know about COVID, the measures that one puts in place in particular to protect people who are vulnerable, those people whose the impact of this disease is greatest. And unfortunately, we've seen that for people who are older in age and people with significant underlying morbidities, and putting in place measures as quickly as we possibly can to try to protect them. And when you look at the speed at which this variant has shown this disease can move, if we have new variants of concern, there's every reason to believe that they could move as quickly as this, and we have to be able to respond quickly and appropriately. And I think we would not claim in any way that we have no room for improvement there. I think every country in the Western can clearly see that there's significant room for improvement in terms of how we can all respond in that regard, and that's what we'll be trying to do over the next period.
The next question in relation to COVID. Or post-COVID, as some people are calling. And there's obviously symptoms with long COVID in relation to fatigue, shortness of breath, cognitive dysfunction, and so forth. How prevalent is long COVID in relation to those that have got COVID? And obviously, you know, a lot of people in the state had, particularly in the last 6 or 7 weeks, a huge amount of people got COVID, and some people would have got it and, you know, and be fine afterwards. But how prevalent is long COVID, and how kind of on a clinical point of view, how concerned would you be with its kind of its legacy in relation to public health?
I might, if it's okay, Deputy Kenny, I might ask Dr. Glynn maybe to come in on that point.
Yeah, thanks, Deputy. In broad terms, there's a range of different studies which have estimated prevalence, and to be honest, we don't have a firm view on it at the moment. It's clear that the vast majority of people who have COVID-19 will recover quickly. You know, will have a form of illness that doesn't require them to end up in hospital or intensive care, and they'll recover relatively quickly in the weeks following the acute infection. But there will be a proportion of people who go on to suffer longer term symptoms for weeks or months following that. There's lots of work being done around better understanding the prevalence of those symptoms, both in Ireland and internationally at the moment. And I know the HSE is standing up an approach to ensuring that people who need access to care for these symptoms will have that access. What I would say is that in broad terms, it appears that, you know, maybe about 10% of people experience symptoms for a prolonged duration beyond the acute period, but that's less in, it appears to be much less than that in children and adolescents. So unfortunately, we don't have a fixed figure at this point, and it's a subject of very significant research and evidence synthesis as we speak.
If you're saying if it's near 10% of, say, adults, then you're talking about over 100,000 people in relation to having prolonged effects of COVID. That's obviously a lot of people, and I'm not sure that's absolutely scientific. But if it's near 10%, and you know the range of time to make a full recovery, it's probably difficult to quantify. But that's, you know, it's slightly concerning that, you know, somebody, you know, perfectly healthy adult could still have symptoms after 3 to 6 months. And what would them symptoms be classically, in your opinion?
So at this point, I don't think we can say that there's a classical picture for long COVID. Also, like, you know, I would definitely express caution around the 10%. It could be anywhere, it could be as low as 2.5%. A big UK study suggested that it was 2.5% of adults between 35 and 70 years of age. And again, down to like 0.3, 0.4% in children. The common symptoms that we talk about are fatigue, shortness of breath, some problems with cognition and thinking. But again, the duration of those and how they recover over time remains an area of significant research. I suppose I'd again take the opportunity to get home the key message that long COVID is a risk for anyone who gets infected with COVID-19. That's a reality, and that's why we have been doing all we've been doing over the past 2 years, and it's why we still continue to really emphasise the need for people who haven't been vaccinated or who haven't availed of their booster vaccine to come forward and get that, because yes, with Omicron at a population level, the majority of people who get infected will not end up in hospital, will not end up severely unwell, but there will be a proportion who do end up in that situation, and there will be a proportion, albeit we can't accurately characterise that at the moment, there will be a proportion who end up with long COVID type symptoms. So again, just take the opportunity for anyone who hasn't been vaccinated. It's never too late. There'll be no judgment if someone comes forward at this stage and says, look, I wasn't sure, but now I've decided that I actually want to get vaccinated. And again, we would say that from the perspective that yes, we're dealing with Omicron at the moment. We don't know what's going to come down the line. We don't know if a new variant that's more severe or more impactful on individuals will come forward in the months to come. So although at a population level we're moving out of this and the picture is relatively optimistic, we don't know what's ahead, and so it remains very important that people protect themselves insofar as they can.
On COVID, if somebody had got vaccines, and are still are suffering from long COVID, is there a medical reason why somebody would still have the legacy of suffering from COVID, even though they've got the 3 vaccines? And I know it's not. We've always said that this is not going to be a complete silver bullet. But is there any medical reason why that person would still be suffering from COVID after 6 months? The symptoms of COVID.
I can't speak to individual situations, but in general terms, the duration of symptoms that people experience does seem to be associated with their level of health before they got COVID and the extent to which they had mild or moderate or severe COVID. But beyond that, I can't really give more details than that for an individual, unfortunately.
Thank you.
Thanks very much.